Hello and welcome to Long COVID Physio Podcasts. My name is Darren Brown. I am a physiotherapist and I am living with long COVID. And today we have our guest, Ted. Hello, Ted. Can you please introduce yourself?
Hi, yeah, Darren, thank you for having me. My name's Ted Deshane. I'm a physical therapist, as we call them here in the States. I work in the Detroit area of Michigan. My specialty is pediatrics, but I also do some contingent work in the acute care hospitals locally, which is where I've had most of my experiences with COVID. Um, so yeah, I've been a therapist for about 5 years and met with this group reaching out for some support for dealing with this illness that we've all seemed to come down with. So yeah, thank you for having me.
Oh, it's great to have you and also to have a proper conversation with you because as you said, like we've briefly met kind of online, haven't we, through our shared experiences of living with long COVID. And I'm actually really looking forward to this because I feel like I know you, but I don't know you.
Yeah, it's quite a interesting and fun little experience to have that we've all kind of had a similar journey and met and picked up people along the way. And yeah, I've gained a lot from you and the others in the group. So yeah, it's great to be able to kind of sit down and talk one to one now.
Yeah, we're all learning from each other. But one question I do have to really ask you is about the animal theme on the wall behind you. We,
Yeah, we live in a little more rural town outside, so we've got a little mini hobby farm here with goats and chickens and all sorts of little
oh,
fun animals.
really?
So yeah,
Oh,
so that's
God.
kind of our little farmhouse theme we've got going on back here. So it's come in handy for all the Zooms we've had to do this year. So,
Yeah. So how much? So you actually have livestock?
yeah, just some small chickens, goats, rabbits. Nothing major, but
Yeah,
just the fun
it's
stuff.
more than I've got. I haven't even got a
Right.
hamster.
Keeps you busy for sure.
Oh, well, for those people that aren't watching on YouTube but maybe listening on a podcast, we've got some lovely animals behind you. We've got like what is that chicken? That chicken with the big headdress thing.
Yeah, so that's I forget what it's called, a silky chicken maybe. We had one years ago and named it Lady Gaga,
Of course.
affectionately. So that's our homage to her. She's unfortunately moved on, but
Lady Gaga is in a better place.
exactly. Yeah. The farm in the sky, we say.
Yeah, the farm in the sky. I like that. Well, Ted, I was wondering if you'd be so kind to share with us your story of living with long COVID.
Yeah, absolutely. So, as I kind of stated earlier, I work in a local acute care hospital here. And back in March, kind of before we really understood what was going on, I'm assuming maybe that's where I picked up my infection. I had the pretty classic symptoms, cough, fever, shortness of breath. I was desaturating, fatigue, all those things. And I definitely kind of dismissed it at first. There was maybe a handful of cases here in the state. So I assumed there's no way I could be in that small group of people here. Um, and it took a lot out of me for quite some time acutely. I probably couldn't really work for 3 to 4 weeks. Fortunately, and I'll kind of touch more on this later as we talk about our topic. Our school went remote, as many did. I'm a school-based therapist full time. So as we went remote, I was able to kind of get through the acute phase of my illness. Um, and even amongst doing Zoom calls and kind of talking to parents on the phone, I somehow managed all that um, uh, and got through that. So probably, so that was mid-March when I got acutely ill. I was probably sort of better by, beginning of April, a couple weeks later. And then just as so many of us have, got right back into it, went to work and went back to, trying to run and exercise and all those things. And that's when I um, started getting sick again. And I thought, well, that's strange. I never was able to test positive. Another common theme among healthcare workers in March, there wasn't testing capacity, nor was I considered high risk. So there was no test that I could take to say that, yes, I definitely had COVID. And that took me a long time to accept that I did have COVID, because, you know, I just never had the positive test. So as I was getting sick, every now and again, I'd have these, what at that point I had called relapses. I would get fevers and cough and short of breath and tired. And I thought, well, maybe this is the time I have COVID, since I didn't have it before, maybe, who knows? So I would get tested, and, you know, at that point, tests were taking 7 days to come back. So I'd sit in my house for 7 days and wait for my negative test. Of course, it was always negative to come back. And I just thought, well, this is the strangest thing. And then I would feel better and go out running and go to work and rinse and repeat over and over again. So, you know, at that point, I had kind of started to see some rumblings of this, at that point, long haulers. They were being called, or post-COVID syndrome, you might have heard. And I thought, well, this sounds strangely like what I'm going through. So I went to my primary care doctor and talked to him about it. And he said, well, let's do an antibody test. That'll tell us. And I thought, okay, this is my positive test I've been waiting for, not hoping for necessarily, but at least it would have been an answer. And that came back negative. You know, this was maybe 5 months later. So who knows? Testing, maybe my antibodies waned. You know, it's hard to say. That was another blow to the gut of finding an answer. So then my doctor just kind of called it a post-viral syndrome, illness, fatigue. Said it will run its course, kind of thing. And I just happened to be on Twitter that evening, you know, just scrolling, and saw some tweets from some people in our long COVID physio group that at that point there wasn't a group, actually. It was just a few of us chatting. And you know, Daria was actually the one who reached out and said, you need to stop. And I was like, wait, what? This is not what I know as a physical therapist. We don't stop. Like, that's not the answer. So, you know, we talked back and forth, and just, you know, between all the people, that the first few members of the group that we had, I was able to kind of validate, yeah, this is what I'm experiencing. And they're having not necessarily exact, but, you know, we're following the same path. We've had the same rinse and repeat, boom and bust, whatever you call it. And it just was like, you know, a light opened up, and I understood what was going on. And you know, ever since then, I've been able to manage a little better, not perfect, of course. But yeah, it's quite an interesting thing we've all been experiencing here.
So it sounds like for you, it's been not only really up and down, but also uncertain in the acknowledgement of, is this even COVID? Because the testing has been a challenge in terms of identifying the cause of this. And actually, it sounds like for you, it's been the symptom profile that has really enabled you to identify that you're living with long COVID.
Yeah, exactly. You know, I think that's part of the process of getting better too, is just accepting that maybe we don't know, but it's okay to kind of, you know, hold on to this for now. But yeah, those symptoms were just textbook, and just hearing the experiences of everybody else, you know, I'm kind of nudging my way into the group without my tests.
Well, it's really important as well that we recognize that, because at the moment we were both, you know, contracting viruses in the beginning of this, and both, you know, if we both got COVID, both got it in March, and there was no testing. And even today, there are still arguments about the accuracy of testing, and you know, there are challenges with the antibodies as well, because evidence is showing that there is a potential gradual deterioration in antibody presence in the body after a certain number of months. So it's really difficult, which is why a lot of the current what's the word? Not guidelines, I suppose, working guidance on long COVID is anyone that has symptoms that are not really representative of another healthcare condition. And so it's kind of a rule-in diagnosis at the moment. I suppose that's not the right language, actually, but if you've got symptoms that fit the profile, then you've probably got it, right? And it's important we recognize that, because so many people haven't had the accessibility to testing.
Yeah, certainly. I think that's important as as healthcare workers too is that we recognize and validate the experiences of our patients, regardless of what they're going through it. So, and we're going through it. So, that was a big piece for me, was just, hearing someone say, yeah, I think you do have this, and this is what we're going to do. So, as we as physical therapists and other healthcare workers move through this, and we get from the acute phase to the chronic phase, which we're muddling in the middle somewhere right now. We need to validate those experiences of our patients and just know that we're there to help them. And that was the first step for me getting better, I think, was hearing my doctor say, he never said long COVID, and I wouldn't have expected him to at that point, but he said, you have some sort of post-viral illness. And hearing our group say, yes, this is what's going on, was kind of the first step to say, okay, I've got this. What can we do now? So that's an important point for us as healthcare workers to kind of go with our patients too as we treat them.
Yeah, and actually I can echo that myself, because my experiences were slightly different, which is that I never had a positive swab test, but I did have positive antibody tests. And my doctors have never diagnosed me with long COVID. I've never had it written down on my records. Not that I've seen my records,
Right.
but it's never been diagnosed. I've always been told, like, for example, when I was sick and not able to work 6 months after my acute episode, I was labeled with post-viral fatigue. That was my working diagnosis, because the language is still difficult, isn't it, around what is it? And so, yeah, I've been referred to a long COVID service, but I don't know that I've been diagnosed with it.
Right. Yeah. Right. Exactly. We're kind of in a gray area right now, so it's it's tough, but yeah, I think we're moving that direction. So
yeah, and I suppose that's all. You referenced this in terms of the phases that you went through with acknowledging the health related challenges that you were experiencing, but also in terms of how you were then self-managing that. You talked about using exercise and boom and busts. What could you tell us more about that?
yeah, so I think our training is that you push and you get better and you try one more mile or one more rep, and that's how you've succeeded. And that's what I was doing. I was doing a run, and I feel tired, and I thought, okay, we're going to do a run a little longer next time. And then I'd go to do my run, and I'm like, I can't get off the couch. I can't lift my head off the pillow. And that was my first sign that something was not right, because I knew what the expected outcome should have been of running, and that's a normal feeling of fatigue and a normal amount of muscle soreness. But this was something I'd never experienced before. This was it's a deep fatigue. It comes from somewhere deep within, and you're laying in bed and you're like, can I open my eyes? Okay, I got my eyes open. Can I lift my head off the pillow? No, I don't think I can today. That's not going to happen today. And that was my first kind of clue that what I'm doing isn't the normal progression of things. And that's kind of when I started seeking help elsewhere and understanding that I was booming and busting, because at first I didn't put the two and two together. I was exercising, I was getting tired, fatigued, tired, and I didn't piece it together. And it wasn't until someone told me, pay attention to when you're exercising, what happens, and then you see the relationship, and you're like, oh, okay, this is, what may be post-exertion malaise kind of feeling. And that was hard at first because I wasn't piecing those puzzle pieces together. I was mostly remote for work, which I'll talk about when we get to that hot topic, was a blessing. I think it saved me for sure, because I probably would have pushed myself right over an edge had I been working and exercising and doing all that. So, the triggers or the whatever is triggering those boom busts was important to recognize, and I think was kind of what this group had helped me understand that I wasn't grasping myself. So
that feels really familiar to me, Ted.
Mm-hmm.
That not being able to piece it together.
Yeah.
Like I'm probably a bad physio in that I don't exercise as much as I should. However, because I was experiencing fatigue, I started to implement my rehab mind. And I was
Right.
like, I need to do a graded exercise program to build up my
Right.
stamina because I'm experiencing fatigue. And I couldn't piece it together at all.
Hmm.
Even though I maybe had been aware of what some people were saying online, I still wasn't piecing it together. The
Yep.
dots weren't joining that exertion was leading to my symptoms becoming worse afterwards. And again, I think this is where these shared stories are so valuable,
Right.
because it's helping hopefully other people piece the dots together.
Hmm.
Because it's been a really common thread for us, hasn't it, in our group particularly?
Yeah, I definitely see that, and I think part of that is our I don't know if you want to call it a type, just our as physical therapists, we're kind of that kind of person. So I don't know if that's it, but you know, um, yeah, we definitely have seen that in our group, and as you'll see on Twitter, as the common theme is, oh, I've been nodding along the whole time because it's just like, yep, that's me, that's what's going on. You know, I
Yeah.
had no clue anybody else was experiencing it, and that's another thing is you have no clue anyone else is experiencing it because we put on our happy face. You go to work, and you know, I don't even know if many of my coworkers know I'm going through this because you go to work, you do your job, and you come home, and then you know, your spouse or partner or family notices what's going on because you can maybe hold it together at work, but then you get home and it's all just downhill from there. So
Yeah.
and that's
Crash.
the invisible illness that we've you know, so many people have been yelling about for years, and it's you know, been kind of pushed aside, and now it's back to the forefront just because there seems to be larger and larger numbers of us. So
Yeah, completely. And I suppose I'm guessing you're referencing there people living with ME/CFS, or so yeah, absolutely. And we're definitely having to rapidly learn so much from their experiences because for us as physios, the stop, rest, pace message is maybe not ingrained in our training or in our indoctrination into
mm-hmm.
rehabilitation.
Absolutely. Yeah. Yeah. I mean, it was even after acknowledging that that's what I had to do. I mean, it was nearly impossible to figure out. I mean, there's so much to do. You have to work, you have to, you know, clean your house, you have to do your laundry, you have to, you know, go feed the goats in my case.
Oh
So,
my God, the goats
um,
need feeding. Yes.
so, you know, you're just running yourself ragged, and you know, then you really have to, the first part of that is stop, and that is what you have to do. You have to stop, and you have to think, which is another thing that's hard to do when you're living with long COVID. But um, yeah, the ME/CFS group has been very helpful in kind of guiding us as a group to treating. So
And you've mentioned work a couple of times, and obviously, when we spoke about this before, our kind of like hot topic, wasn't it, was going to be kind of
yeah.
living with long COVID whilst working and
Hmm.
responding to the global COVID pandemic.
Yeah.
Yeah, tell us more about your experiences in terms of living and working with COVID.
Yeah. So it's been tough. You know, I've been fortunate. So many people that I hear have had to take, you know, weeks and months and time off work, and I was fortunate not to have to do that in the traditional sense that maybe some of our group has. You know, as I mentioned, our school went remote, so I was working for home for many months, and then we slipped into summer. We have summers off from the school job, so that kind of I think was a natural um, kind of what's the word I'm looking for, like just natural time off. I didn't have to take like a sick leave or anything
Okay.
because I was able to work remote. You know, I have three jobs. My full-time job is my school-based job. I do summers in weekends at the acute care hospital. I do evenings and summers at the children's hospital. So, you know, I have all these jobs, and just kind of scaling back was tough.
Hmm.
But you know, this isn't like I would say this isn't like a knee surgery or back surgery. You can't just take 6, 8, 12 weeks off and jump right back in. Um, you know, we've seen over and over again that people, you know, jump back in thinking they're good, and then all of a sudden, they've crashed and they're back to, square one essentially. So, yeah, it has not been an easy journey for myself or anybody here, for sure. I seem to have lost my train of thought here. So,
Well, you raised a really important point there about, you said your work kind of shifted in a way to
yeah.
being more, I suppose, tele-rehabilitation, being able to work from
Hmm.
home and using technology to provide your physical therapy interventions online.
Yeah.
And I know that one of the recent preprints on characterizing long COVID, there was some data in there about people's experiences with long COVID and work. And one of the things that was reported to be supporting people to at least try and remain in employment was actually working from home and tele-rehabilitation. Why was that different for you? How did that help you?
Yeah. I think part of the thing was just, especially at that stage where I was at the beginning of my long COVID illness, I needed that physical rest, and I was able to have that kind of working from home.
Hmm.
You could, essentially do it from the couch, and that's all I could really manage at that point. But you also didn't have all the, I guess you did it, but in a sense it shifted. There's a different kind of cognitive and cognitive stress that goes along that. It was picking up something new, but also things were scaled back a lot. Parents were busy with school, so maybe they were less focused on the physical therapy aspect of their schooling. So just being able to sit on the couch, make my own schedule, and if I needed a break in the middle of the day, I had that. If I needed to finish some things up at night, I could do that. If I needed, an extra hour in the morning to get myself out of bed and dressed and looking appropriate, then I could take that. So, and I think that's the tough part about our job in most settings, is that the schedule is there and it's brutal. You have to go. There's patients to see, there's meetings to have, there's paperwork to finish, and you have to somehow squeeze that into your 7, 8, 9, 10-hour day, whatever you're working. And working from home just kind of allowed you to self-pace and not have to worry about the schedules of others as much. And I think that was really important, and a really important thing that as people are phasing back to work, they can kind of use to not make it such a dive into the deep end. What can we do to kind of build in breaks throughout the day, and what can we do to kind of adjust to how I'm feeling? Maybe I'm okay today and I can do a little more, and maybe I can't at all. And you kind of have to judge that day by day. There's no, like, you can't schedule your rest break next Tuesday because it might be here Thursday morning. It's tough to manage for sure.
Yeah, completely. Like, I know from my own personal experience, I've not been able to do working from home or telehealth because I've been needed in an inpatient setting because the
Hmm.
demand has been there,
Yeah.
and there has been changes to the provision of care that we can provide for certain, even though there may be essential rehabilitation services, the critical and acute side of things has taken all of our demand and
Hmm.
capacity. So I know from my own personal experience working on the wards, like you were saying, the cognitive loading is totally different, I would presume,
Yeah.
working from
Hmm.
home to being in a clinical setting. Like you said, there's all those different demands. I know for me, like being on a ward, it's not just the demands of what's my caseload for the day, it's then navigating how you coordinate that, request
Hmm.
help, answer the phones, do everything that you need to do with the MDT, as well as planning everything that comes with it, that actually you're spinning 25 plates at the same
Yeah.
time, which just doesn't seem to be the case from what I'm hearing of people that are doing outpatient telehealth services, which is I can focus on what's in front of me.
Right. Yep. Yeah. And I've been on both sides of the coin, at my acute care hospital.
Mm.
We've been through several waves. I'm still working there on the weekends and on some breaks. And um, yeah, it definitely is different. And I've actually kind of chuckled to myself because, you put on your PPE and you get ready to go and work in the COVID floors. And sometimes I actually find the COVID units quite comforting and a little bit of a break, because my phone is put away. I can't answer it because I've got my PPE on. There's no extra people coming in to find you when you're in the COVID unit. It's very, bare bones, and the patients need lots of rest breaks, and I need lots of rest breaks. So it's kind of like almost a perfect fit when I work in the COVID unit, because I'm like, okay, you're tired. Okay, me too. Let's sit and talk about how we can breathe a little better right now. So despite having all the PPE on, and sometimes they need a lot more help than maybe a typical patient might, there is some sort of relief when I see that I'm scheduled in the COVID unit that day, and just kind of knowing, okay, we can relate a little bit, we can talk, and we can rest together too, because we both need it. So.
Oh, wow, that's amazing. And I hadn't thought of that at all. That's
Yeah.
a really interesting reflection.
Yeah. I just thought about it one day when I came home, and I was like, I used to be really tired when I came home from the COVID units, because I was, working really hard and pushing them and pushing me, and the PPE, the protective equipment is obviously very exhausting, in itself. But I came home one day and I thought, that day wasn't so bad. And I thought, why wasn't that day so bad? And I'm like, oh, it's because so-and-so needed 10 minutes to recover from their, walk to the chair, and we were able to sit and, and that's kind of when I shifted my perspective in treating some of these patients too, is obviously the physical part is there too, but also just connecting with them and talking about, how to kind of move through their phase of COVID, and talking about the resting and pacing and things I wasn't mentioning to those patients early on. And a lot of them kind of, perked up a little bit, like, oh, I never thought about my breathing pattern and how that's affecting my endurance and fatigue that day. So, I obviously many PTs are bolstered by their personal experiences. So this has been no difference there for me here. So.
And that's so lovely to hear that as well, because it echoes what Carolyn said in the last podcast, which is how being a physiotherapist or physical therapist, and now having gone through this journey, may have improved her approach and responses to supporting people through their rehabilitation. And it sounds like that's been the same for you as well.
Yeah, absolutely. No doubt.
Yeah. Like, I'm wondering, what have been, you sound like there's been positives and negatives in terms of working through COVID and living through COVID. So one of those positives has been your own development in terms of your practice, and especially it sounds like with communication skills, but the other has been the negatives around pacing in the workplace, whether that be remotely or in person. Have you had any particular moments where you've figured that out, or figured out what hasn't worked so well in terms of how pacing in the workplace functions?
I don't think I figured it out yet, but
do you know what? That's the reason I asked you, because I haven't figured it out either.
I think we talk, we talk a little bit in the group. There's, we've mentioned the spoon theory, which I just can't grasp. So I prefer I think it was you who brought up the battery, and I much prefer that analogy because it makes more sense to me. And some days I just, feel like maybe I'm a 2-year-old iPhone and I just can't keep a charge. And that's somehow just how the day goes. And I think just understanding what your battery is at that day is kind of going to tell you what you can handle. If I'm only when I get up, if I'm only at 50%, I know that I have to do something when I go to work that's going to, not make me crash when I get home, or prevent the crash the next day. So I think just the recognition of what's going on internally is really important, but also then you need to reach out and find support. And that's really hard to do for me and many other people, but the important part is telling people how you feel. I noticed one day I was very scattered and I wasn't so physically drained, but I couldn't focus on anything. I couldn't make a sentence. I couldn't do my paperwork. And I just had to tell somebody, like, I'm sorry, I cannot do this right now, and I just had to say, we're going to have to talk about this like another day. And it's nothing against you, but I just can't put myself into it right now. So I think the reaching out is really importance, reaching out to management when possible, but also your coworkers, your peer coworkers, so they know when to support you, because they likely want to support you. They want to help you as well, and they're going to be there for you, but you have to reach out. They don't know what you're going through unless you tell them. So I think reaching out for help when you're having a bad day and saying, hey, can you cover this for me, or can we move this to another day, kind of thing, it is really going to help you kind of stop and pace and make it through the day, so you can do something when you get home, or get yourself together the next day.
Oh, it's so true, Ted. It really is. Like, well, first of all, I just want to come back to the point of the 2-year-old iPhone. I mean, that is spot on.
Yes.
I mean, it is literally it, isn't it? Like, my battery is running out all the time, whether it's charged in or not.
Yeah, exactly. Yeah. And I don't know if I've gotten past
love
80% since I've, had long COVID, but
yeah. And if anyone listening isn't aware of the spoon theory, what we can do is we can try and put some links in underneath. But yeah, I concur. I'm not really good with the spoon theory. I get confused about how many spoons I've got, or where I left them, or whether I've
right,
loaded them out,
exactly.
or whether they've got jam on them, or
right. Yes.
But you were saying there about the difficulty in acknowledging our challenges and accepting that we have those challenges, and then with that being able to reach out for help. And it's only once we've reached out for help that we can be supported best. I know that I'm not shy in coming forward. I had a really bad day on Friday, as you know, because I posted it in the group. So, I was cognitively overstimulated and I was overwhelmed, and I had proper sudden onset brain fog and couldn't process, couldn't plan, couldn't think, couldn't read, couldn't write, couldn't do it all. And I just crashed. And I'm so lucky that I was able to speak to my line manager, and I will give a big shout out to Laura and say thank you, because she had to suffer with me ugly crying over the other side of the phone. Like, I was properly bawling my eyes out because I was scared. I was genuinely scared that it was coming back, because working and responding in the midst of a global pandemic. And I for those that are listening, I live in London, and at the minute we're at the height of our second wave, and we have a worse situation than we did in our first wave. And so the pressures are real. And when living with an episodic and unpredictable health condition now, whilst trying to also be part of that response, is really difficult to navigate.
Yeah, I mean, it's nearly impossible for someone who's not suffering with the chronic illness to manage right now. I mean, we see it constantly, but then to throw in that extra curveball of having the brain fog and having the physical fatigue and not knowing what tomorrow is going to bring for your own self, let alone the state of the country, world, etc., really puts a lot of pressure on us as clinicians and healthcare workers to kind of deal with that. So, and that's where we need to recognize when we can and when we can't. And if you can't, you can't. And you can push, but then you're going to be on the couch for the next 3, 4, 7 days, and then you're no help to anybody. So, the recognition is super important.
You've hit the nail on the head, haven't you? There, really, we can't help others if we can't help ourselves. Completely. So what do you think has been the biggest thing that you've learned during this process? Sorry, that's a really horrible question. Why am I asking questions like that?
No, it's a great question.
You're a font of knowledge, and you're coming up with all of these like amazing snapshot messages, like 2-year-old iPhone. Like, I want to ask you more.
Well, I appreciate that, because I'm not as snappy as I used to be, it feels.
My God,
so I've rested up for this podcast. No, sorry, can you repeat the question? Because it
was a horrible question. It was like, I think I was just diving into like, oh my God, what's the biggest thing you've learned now?
Yeah. No,
COVID.
Yeah, I mean, I think the internal recognition has been the number one thing I've recognized. I mean, I'm if it isn't evident by having 3 jobs, I'm a workaholic. I've always worked that many jobs and pushed and worked, 6-7 day weeks, and you just have to have an internal moment and conversation with yourself where you say, I can't do this. And that's a hard phrase to say. And maybe the better phrase would be, I can't do this right now. And maybe there's a better time when I can do this. And because I do want to save some of my, last 10% for being at home and, my family and those kind of things. So, it's easy to put it all and use your whole 80% at work, but, who's suffering at the end of the day, and is that, the best for everybody. So, I think just having that internal recognition is number one, and is going to help you go the furthest.
Completely. And that being kind to ourselves is so difficult, because we're so used to, maybe I kind of feel like you and me are relatively similar in terms of being a bit of a workaholic and go. I know that I've recently had to learn that I find value in productivity.
Yeah.
Therefore, being sick has stolen that identity and value from me.
Right.
But yeah, it's really hard to acknowledge, really hard to seek help. Like you said, we're not helping anybody if we can come home and have nothing left in our 2-year-old iPhone battery.
Yes, exactly. Learning from the CFS group, there was one phrase that really hit home, and I think a lot of people don't realize until it's too late, as that, the decisions you make in the beginning of your journey with long COVID, chronic fatigue, so on, are really going to guide the rest of your recovery. So while it might seem like you need to push through it, I mean, that period of rest at the beginning is really, really important. And again, I think what saved me was being forced to rest, by the governor of the state to say everyone in the school has to stay home. And because I wouldn't have stayed home had it been the option, I would have been out there doing everything. So, for those who aren't forced to, stay home, those in acute care, those in outpatient, those who are still working, you have to take that time at the beginning to say, I need to rest, I need to recover, I need to let my body heal. Because those decisions you make in those first 4, 6, 8 weeks, are going to be how you may feel, the next couple of years. So, forcing yourself to take those moments is really important, I think.
And what would you say to people that are so desperate to get back into physical activity, or even clinicians who may be actively wanting to do the best for their patients, but even those that may be symptom-free, for example, say over a week, what would you say to them who may be trying to encourage physical activity and exercise?
Yeah, I think you have to take that step back and say, what would I tell a patient who is in this situation? If you have a cardio patient with a low ejection fraction, you wouldn't tell them to go, do everything under the sun. And while that's not what's going on here, it's the same idea. Think about how you would tell your patient to adapt, and how you would tell them to, change their environment to fit what they can do right now. I don't know, I'll speak for myself, but I'm a horrible patient. I don't listen to any advice that I might give out. So I think we kind of need to say, like, what would I tell a patient who is in this situation? And then you need to do that. So it seems to be a problem among our group, is that, we're not that great of patients.
Yeah. And I think that probably comes back to the most consistent theme that we seem to have, which is that as physios, we really struggle to stop rest and pace. And we are professionally focused on moving more, and that process of coming back to not moving, to not being active, in fact, so physically, cognitively, mentally, and resting, radical rest, just feels so alien. And it seems to be a real common thread amongst us as physios, doesn't it?
Yeah, absolutely. I mean, it's not natural for us to want to sit down and not even read a book, not even, scroll through the research on long COVID. You just have to sit and put the phone down and put the books down and the literature down and just sit. And that's nearly impossible to do. But if you don't do it, your body will force you to do it, unfortunately, is how it works. If you think you can get around it, you cannot. I mean, at some point your body is going to say, okay, you're going to lay in bed for 3 days. Sorry. Like,
Yeah, felt that. Yeah, very, very easy to end up doom scrolling through Twitter, isn't it? And then
yeah. Yeah. Yes, it is.
Oh dear. Well, Ted, I'm going to say thank you so much for this today, because I think this has been a really lovely opportunity to hear your story, and also get some really key topics discussed around rest, pacing, and also the challenges in terms of working, but maybe some opportunities in
Mhm.
terms of taking advantage of technology, and advancing that, because we know that there is that opportunity. So unless you had anything else that you would like to say, I wanted to say thank you.
Yeah, thanks so much for having me. I just wanted to close with kind of an overall, just challenge to those who are living with long COVID and trying to work. Reach out to your coworkers, reach out to your HR department, your unions, whatever you have to help you, and really figure out how you can do it and do it safely and make yourself effective. Because as we've stated over and over again, you're no use to anybody if you end up in a bedbound state. So reach out, ask for help, stop, rest, pace, all the stuff we've been talking about. But yeah, thank you so much for having me. It's been fun and glad that we got to chat. So.
Yeah, it was lovely to chat. So thank you very, very much.